What is type 1 diabetes? Today, we'll be exploring this question with the help of a medical expert from the prestigious Mayo Clinic. Dr. Yogesh Khudva, an endocrinologist and holder of a Bachelor of Medicine and Bachelor of Surgery, will provide us with a comprehensive understanding of this chronic condition. Type 1 diabetes, previously known as juvenile diabetes or insulin-dependent diabetes, is a chronic condition where the pancreas produces little to no insulin. Insulin is a hormone used by our bodies to allow sugar or glucose to enter cells to produce energy. Various factors, such as genetic traits and certain viruses, may lead to type 1 diabetes. While it usually appears during childhood or adolescence, it can also affect adults. Symptoms of type 1 diabetes can suddenly appear in children and might include increased thirst, frequent urination, bedwetting in children who previously didn't wet the bed at night, extreme hunger, unintentional weight loss, irritability and other mood changes, fatigue and weakness, and blurred vision. If you or your child are experiencing any of these symptoms, seeking medical advice is recommended. The exact cause of type 1 diabetes is unknown. Usually, the body's immune system, which normally fights harmful viruses and bacteria, destroys insulin-producing cells in the pancreas. Potential causes may include genetic traits, exposure to viruses, and other environmental factors. Once a significant number of insulin-producing cells is destroyed, the body's insulin production decreases or stops entirely. Insulin is a hormone secreted by a gland located behind and below the stomach, the pancreas. Insulin is released into the bloodstream and allows sugar to enter cells, reducing the sugar level in the blood. When blood sugar levels drop, the pancreas secretes less insulin into the bloodstream. Glucose, or sugar, is the primary energy source for the cells that make up our muscles and other tissues. It comes from two main sources: food and the liver. Sugar is absorbed into the bloodstream, from where it enters cells with the help of insulin. The liver stores glucose as glycogen. In type 1 diabetes, there's no insulin to allow glucose into cells, which results in sugar accumulating in the bloodstream. This can lead to life-threatening complications. Risk factors for type 1 diabetes include having a family history of the disease, certain genetic traits, geographical location. The number of people with type 1 diabetes increases as you move away from the equator. And age. Type 1 diabetes can appear at any age, but it usually shows during two peak periods, between 4 and 7 years and 10 to 14 years. Complications of type 1 diabetes can affect major organs in your body, including your heart, blood vessels, nerves, eyes, and kidneys. Maintaining normal blood sugar levels can reduce the risk of many complications that can cause disability or even be life-threatening, such as heart disease. In summary, type 1 diabetes is a chronic condition which requires careful and consistent management. Symptoms can occur suddenly, and if left untreated, can lead to serious complications. Therefore, it is crucial to seek medical advice if you or your child are experiencing any symptoms.